Hi, everyone. Welcome to our next session in our Boosters and Beyond series. As you know, we've been talking about the CDC's core infection prevention practices for safe healthcare delivery in all settings. Today, we are going to be talking about injection and medication safety. But before we get into that, we do just have a couple of housekeeping items to get through. So if you're not familiar with who we are the IPRO QIN-QIO. IPRO holds the federally funded Medicare QIO contract for the regions shown here. Specifically, IPRO helps support New York, New Jersey, and Ohio. Health-centric advisors help support Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. And Clarent helps support Maryland, Delaware, and the District of Columbia. Together, we are three organizations under the IPRO QIN-QIO banner. So if someone asks you if you're working with IPRO, or if you know who IPRO is, you say yes. With that, I'll pass it over to Mary Ellen to give us our COVID-19 update.
Thanks, Josh. So hospitalizations again are down as of the 1st of March with a 7-day average of a little over 3,000. Good news. The bivalent booster slowly ticks up with getting close to 54 million folks receiving that updated booster. 41.4% of adults 65 and older have received the booster. The latest variants again haven't changed. They're really seeing a consistency with this XBB 1.5, as you can see, almost 90%. Again, highly contagious, but very minimal symptoms with this, and that has been consistent throughout the season. So we'll keep track of that. Next slide. And we're still hovering at 53% as far as the NHSN data showing updated bivalent boosters for residents. Again, really hard work to get this number moving, but because of you guys, we're getting there slow but sure. And I just also wanted to let folks know, and I'll put it in the chat, that the Advisory Committee for Immunization Practices is actually hosting a Zoom update on March 22nd. I know there will be discussion about what the COVID vaccine schedule will look like. So I will put the registration link in chat for folks who are interested in that. And I will participate in that and give a summary to folks to catch up. And that's it.
Perfect. Thanks so much, Mary Ellen. So at this point, I'd like to introduce Marcy Medley, as well as Vicki Kilby, who will be our presenters for today's session. And with that, I'll pass it over to Marcy. Thank you so much for getting us started.
Thanks, Josh and Mary Ellen, for getting us started off today. I wanted to say hello and thanks to Vicki for helping with this. I'm one of the quality improvement specialists with IPRO, and Vicki Kilby is one of my colleagues who has over 20 years experience as a regional pharmacy nurse consultant. So we're really excited to bring you this information today. You can go to the next slide. We are continuing on our CDC core IP practices, and we started here just putting out what the practices were from the CDC. We have the link there so that you can look through what they are. They do tend to be around medication injection safety, because that is the highest risk event that we do in our nursing homes. Next slide, please. So the one and only campaign, this is the CDC's campaign aimed at eliminating unsafe medical injections. And it's one needle, one syringe, only one time. Seems like we should all know this, we should all be doing this, but there continues to be unsafe medication practices happening throughout the country in our buildings. I put a statistic up here from their site. And their website is wonderful. There are PowerPoints you can use for education. There are posters. There's additional FAQs, which I'll go over a few of those today, about eliminating some of these practices that are still happening. Next slide, please. So the injection safety tips I really want to go over follow three basic components: before the procedure, during the procedure, and after the procedure. So before, the biggest thing that the problem can be is between and it's always listed in case anyone doesn't know, is SDV and MDV vials, which is single dose vials and multi-dose vials. So we use both of these when we're passing medications in any facility. Single dose vials are one use only, one patient, one time. They always need to be thrown away when they're done. Multi-dose vials are things that we use more than once. And we typically try to keep those, and the best practices for one patient only. However, there are some instances such as vaccinations that we do need to use those on different patients. So the biggest thing with that is before the procedure, knowing which vial you're using and how to check that. Check your expiration dates and make sure there looks like no contamination in the vials. And when in doubt, you always throw it in the trash. No question, you just do it. During the procedure, you want to make sure a new needle and syringe is always used. There is no reason to ever use something different. When you are pulling from a multi-dose vial, unless you are doing a sub-Q injection, which usually we would see this with maybe a PPD injection, which would be subcutaneous injection, the needle should be removable from your syringe. And even after pulling out that from the multi-dose vial, you should throw that syringe away and place a new, the needle away and place a new needle before injecting that in your patient. And that's the best practice with that. With sub-Q needles and the way that they're made, most cannot be removed. So you need to make sure you're following the policies. And I know later Vicky's going to go over some of that. The other thing, during the procedure, you need to be in a clean place and you have to label all your supplies. So if you're pulling out a flu vaccine for a patient, I'm going to use that example. It's something we do a lot, a flu vaccine, a COVID vaccine from a multi-dose vial. We need to have the supplies in our clean area to label that syringe with what patient this is going to and what is in the syringe. Things happen all the time. We all know this, and we might not know what's in there anymore. If a syringe is not labeled, it should never be used. And then after the procedure, making sure that we're not taking multi-dose vials into patient rooms. They should always be used in a clean procedure area. There is one exception with this, and we're going to get to that on the next couple slides. But usually this needs to be done in a medication clean area. That could be considered your medication cart if it has been clean and you're following proper procedures for your facility. Also, after the procedure, you need to make sure you're throwing everything away that you should not need anymore prior to leaving the patient's room. Syringes and used needles should go into a sharps container prior to leaving the room. If you don't have them in your patient rooms, you should have portable small containers that you could take in. You shouldn't be carrying dirty needles out to medication carts. You can go on to the next slide. So with injectable medications, one thing, single dose and multi-dose vials can get very confusing. It's not about the size of the vial, it's about how it is labeled. And I put this on here because some of the biggest bottles are actually single dose vials, and some of the smaller ones are multi-dose vials because they don't need as much of the medication. So make sure you're checking labels. I also put some great considerations as an infection preventionist or someone that's watching medication passes, thinking through your policy and procedures. Do you have enough supplies to ensure these injections? Nurses should not be looking for extra needles, the right size syringe, any of those things when they're trying to draw up medications. It makes it much more difficult and errors are likely to happen. Are you purchasing the safest available equipment and medication? If it comes in single dose vials, you should be using that. They can be thrown immediately away, and there is much less risk of spreading any infectious diseases by improperly using syringes or draw up techniques. Do you have infection control training for your personnel? Do they know this? And watching skills validation, watching the nurses draw up medications, how are they taking them out to the medication carts and distributing them out to the patients? Next slide, please. So insulin pens is the most common multi-dose vial that we use in our facilities, and it is one that we take into the patient environment. It it is not, unfortunately, it's the way that it has to be. And we need to have some really good infection control processes around this. Things to remember, things that we've seen in surveys, they are never used for more than one person. There is never a reason that that should be done. They are one patient specific only, ever. The pen in the storage container is labeled and dated with the open date. If it is not, it needs to be thrown away. Nurses need to know to look at the liquid inside the pens. That's something that they miss often. They just pull it out. The date looks okay, but there could be discoloration in there. And if that happens, the pen needs to be thrown away. Everyone needs to know storage parameters, usually 28 days out of the refrigerator dated, but there are some differences with this. So knowing that and having the policies and procedures in place. The big one is wiping the pen hub before they apply the needle. A lot of nurses forget that because this is patient specific, that they forget this step of really cleaning off the hub before they apply a needle. It is the same as accessing any vial you would ever access. It must be cleaned before the needle is applied to the hub. Needles need to be disposed inside the room before leaving the patient room. As I said before, you have to either have sharps containers in your rooms or a way to transport those in and out in a clean and infection-free environment. The cap should also be replaced to the pen. So that's one of the reasons that you have to get rid of the needle. You should not ever be recapping an insulin pen with a needle on it. The needle should be removed before the cap is put on, and cap should be placed prior to leaving the room. And insulin pens should not be down in our scrub pockets. I don't know how many times I've walked to people, they have all kinds of things in their pockets. They should never, ever be there. They need to be on a clean space and never placed in a pocket or in a lab coat. Next slide, please. So this is kind of a question to keep everybody thinking. As I said, insulin pens are a multi-dose vial that enters the patient care environment. The recommended practice is that multi-dose vials never enter a patient care environment. And if they do, that is for one patient only. So we know the insulin pen, one patient only, but how do we ensure that that device is clean and sanitized? What if someone sticks them down in their pocket? How could we clean that? A lot of times there's labels from the pharmacy on there. You can't just kind of wipe them off. It will smear everything. So be really watching and being out on those medication passes and showing good procedures to our staff is very important in this situation. Next slide, please. So common errors with injectables. I just want to make sure that I think I covered most of this, single dose vials discarded immediately. We never save them to get a little bit more out of there for any reason. We do use some single dose vials still in our facilities. So make sure they're getting thrown away. You ever find them, education needs to be done. Multi-dose vials used for multiple patients. Vaccines, PPD are two big ones we do all the time. They should be stored and accessed in the clean area. So a multi-dose vial of flu vaccine or PPD should never be taken in a patient room. If it happens, it should be thrown away. If you have to grab something out of a stat box or emergency box and it's a multi-dose vial, it needs to be labeled and opened with the patient's name and date. Some of that's for billing, some of that's for infection control, but if you're grabbing something out, make sure you get it labeled. And refrigerated medications can also become a problem here. If we take PPD solution out to the med cart and leave it out there too long, then it's not going to be good anymore. So make sure that everything gets right back to the refrigerator right after you're finished using it. Next slide, please. So we're going to switch gears here a little bit. I wanted to talk about injectables, but here's what we saw, 2022 survey deficiencies. So a lot of us know the second most cited deficiency in the entire country was F880 infection prevention. It's why we're talking about this. It's why we talk about a lot of things. It is only behind NHSN data, which of course can be cited offsite. So it's the #1 on-cited deficiency there is. Labeled and storage of drugs and biologicals over the 2022 survey was the 7th most cited. So we're going to move into medication administration and medication storage. Next slide, please. I'm going to turn it over to Vicki, and she's going to give you some great tips.
Thank you, Marcy. Now let's talk a little bit about infection control during the MedPass. Specifically today, we'll cover hand hygiene, when the staff should be using soap and water, the use of PPE, what is considered a clean barrier and when that should be used, sanitizing the med cart and cleaning equipment used at the point of care. Working with your staff during the MedPass is the key to success in avoiding unnecessary tags during survey. You should be completing MedPass observations on a regular basis with both your nurses and your CMAs. It's a time when you will be able to identify staff needs and provide one-on-one education on good infection control practices. A reminder, the more you work with your staff, the more comfortable they are going to become when they are being monitored, and avoid unnecessary mistakes during MedPass observation. When you are working with your staff, I want to remind you that this is a learning experience. You're going to be learning, they are going to be learning. Next slide, please. As we all know, hand hygiene is our primary defense from acquiring or spreading infections. The CDC recommends the use of alcohol-based hand sanitizers as the primary method for hand hygiene in most healthcare situations. There are times when soap and water is required. They are when your hands are visibly soiled, prior to the administration of eye drops to avoid possible irritation from alcohol to the eye, and to avoid introducing germs into the eye and causing infection. When caring for a resident with a known or suspected GI infection, and you want to make sure you are looking at your hand hygiene, the recommendations from the manufacturer, frequently they will recommend washing with soap and water in between hand sanitizer use. Next slide, please. Gloves need to be worn by staff when they're performing the following procedures. Of course, we know they should be using them anytime there is a possibility of contact with blood or body fluids, when they're obtaining blood samples, administering injections, and obtaining finger sticks. They also should be using gloves if they're going to be touching tablets or opening capsules. Frequently, they'll ask me at the med cart, do I need to put gloves on to open the capsule? The answer is yes. They should be using them when applying or removing skin patches to avoid contact with the medication on the patch. And they should be using gloves when they're administering tube feedings and medications via the G-tube. They also should be using gloves when they're assisting or administering with any handheld inhalers to avoid contact with respiratory secretions. And I would just want to remind you and the staff, the proper procedure for administering eye drops is hand washing first with soap and water, donning a clean pair of gloves. You want to make sure they're using a non-touch method when instilling the eye drops. The eyedropper should never come in contact with the eye or the eyelid. If the patient does have an infection, you want to make sure they are working from the unaffected eye to the affected eye, and they are using a clean tissue for each eye. Next slide, please. Clean barriers must be used when having to place an item on a surface in a resident's room. And we see this frequently when the staff's carrying in multiple items and they sit them on the bedside table. Anything that needs to be returned to the med cart needs to be used with a clean barrier. They should be making sure the surface in the room is clean and dry. Then they can lay whatever they're going to use as the barrier on the table. A clean barrier can be a MedPass tray. It can be a paper towel. It can even be a MedPass cup. If the barrier prevents contamination to the med cart and provides a clean working surface in the room. You want to encourage your staff to use MedPass trays, if at all possible, to manage transportation of multiple medications into the room. We all know there's those times when they have a whole lot of MedPass cups, a cup of water, gloves, eye drops, multiple medications that are going into the room. Use the tray as their working surface. If the tray is disposable, it can be disposed of in the room. They can throw the cup if they're using that as their clean barrier in the room. Anytime they are using a reusable MedPass tray, it needs to be wiped clean with the appropriate disinfectant before it comes back to the MedPass cart and is placed on the top of the MedPass cart and used for the next resident. At no time are items to be transported in or out of the room in nursing uniform, pockets, jackets, or otherwise. And we see this all the time. It is a breach of infection control. Next slide, please. The med cart should always be clean and sanitized and orderly upon approach. When you are looking at the top of the med cart, you should see the cups and the spoons stored upside down, and they should be covered in between MedPass times. Any supplements, applesauces, puddings, and thickened liquids should be dated. You need to follow your facility and state guidelines as to when these items should be discarded. Water pitchers should be sanitized daily. Most facilities will send them to dietary to put them through the dishwasher on a daily basis. Any spills, any drips should be wiped up immediately. Look at your trash containers. Are they full of dry spills? Is the trash overrunning? Okay, start out the MedPass with everything very tidy. Pill crushers are another item that you rarely see staff wipe off. Make sure they're clean, make sure they're in good working order. No personal items should be stored on top of the MedPass cart or inside the MedPass cart. Think about how many times you've gone by a MedPass cart and the nurse will have her morning coffee, snacks on top, and you know, if you have the occasion to open a drawer up, her pocketbook is generally in the bottom drawer. Sharps containers should be emptied and should be replaced when they are 2/3 filled. Next slide, please. When observing MedPass, you should be checking to see if the staff know how to clean and disinfect the following items, specifically glucometers, INR monitors, nebulizer mask and machines, those blood pressure cuffs, those stethoscopes, and pulse oxes that are going into the room with them to use on each resident. IV poles have been a major source of contention in the years that I have monitored MedPass. When I ask the staff who's responsible for cleaning, the nurses will tell me it's EVS. EVS will say they're not touching it. It's medical equipment, that the nurses should be touching it. Ask questions, see what's going on, see how familiar your staff is with what needs to be done with these various items that are being used at the point of care. Suction machines are another source of contention. Frequently, you'll walk in the room, they'll be uncovered. The canister will be full of respiratory secretions. The catheter itself will be out floating around, laying somewhere, hanging on the floor. You want to make sure that these things are being cleaned and placed back in the appropriate containers. Don't be afraid to ask questions. Remember, this is a learning experience for both you and your staff. Next slide, please. Cleaning and disinfecting glucometers and INR monitors. You always want to check, first of all, to see what the manufacturer's guidelines are for cleaning and disinfectant. Some facilities will have residents with their personal glucometer in the drawer. I will tell you that each glucometer manufacturer will have different recommendations as to how the glucometer should be cleaned and disinfected in between use. become familiar with the glucometers in your facility. In general, they should require a two-step process where they're being wiped first for cleaning, and then the second wipe is a disinfectant. There's also recommended wet times, and that wet time is when the cloth with the disinfectant should be in contact with the glucometer itself. We do know that bleach should be used anytime we're dealing with residents with C. diff, but you want to pay particular attention to this process the staff is using for cleaning and disinfectant. Failure to disinfect according to manufacturer's guidelines can result in a high level of tag during survey. It actually will cause the surveyor to go to Appendix Q and follow the guidelines for an immediate jeopardy tag. Marcy, did you have anything else? That I know this is one of your passions.
I just want to say that this is the most frequent immediate jeopardy I've ever seen across the whole country. FTEG 880, the critical element pathway. I think Josh has the link. You can get there. And you can scroll down and look. They're under, when you go to the CMS site, everyone always says it's hard to find them. If you scroll down to the link at the bottom, it says survey resources, and then all the long-term care survey pathways are there. F880 specifically asks the surveyors to look at glucometer cleaning. So you need to make sure you have a good policy for this, and that it is two-step. For cleaning and disinfecting and following the guidelines. I think that's it, Vicki.
Okay, thanks. Josh, next slide, please. Okay, we want to take a look at nebulizers. The first thing that I want to say to you is check and see if the nebulizers are still in use. If they're not in use, make sure they're removed from the room. This is a source of, again, an infection control tag. So many times these machines or nebulizer treatments get ordered and they just stay in the room forever. And if you're asking the staff, they don't even know when the last time it was used. So you want to make sure they are in use. And if they are in use, you want to make sure the machines are wiped, cleaned, and they're covered with a baggie in between use. The nebulizer mask requires cleaning in between use. The mask setup should be unassembled. The mask, the mouthpiece, and the med cup should be rinsed under warm water for at least 30 seconds. Then the pieces of the mask setup should be placed on a clean surface, allowed to air dry, and then placed in a baggie to avoid contamination. Take a minute and think about the following question. Do you have a policy for changing nebulizer setups? And if so, where are you documenting that? Next slide, please. So these are some equipment, additional point of care equipment that we want to talk about. You want to make sure that your staff knows how to clean thermometers, stethoscope, blood pressure cuffs, pulse oximeters. Again, I mentioned the use of IV poles. The IV pumps. IV pumps are usually sent from the pharmacy. They are sent for use on one particular resident. When the therapy is completed, they should be returned to the pharmacy because the pharmacy does a terminal cleaning and calibration. Suction machines should be cleaned. They should be stored in the room. They should not have any secretions in them. Any secretions should be removed immediately. Suction catheters should be rinsed and stored in the suction catheter sleeve or in a clean baggie. Next slide, please. Okay, so when you're going with your staff, you want to make sure that you are reviewing the inside of the med cart with them. I think that so many times we don't realize that nurses skip from one building to the other. They're very nervous. They've never been monitored on MedPass. They don't know about infection control on the med cart. Okay, so you want to make sure that medications are being stored by route of administration. Review that. That top drawer in the med cart is where they usually throw everything. You're going to see eye drops, ear drops, nitroglycerin tablets, glucometers, crackers, whatever. Go through that top drawer with them. Make sure medications, as I said, are stored by route of administration. All bulk items need to be labeled. They should be labeled with the resident's name and the date open. If it's a house stock item, I generally still recommend dating it when it's open, but you also want to make sure that that they're checking the expiration date. Topical ointments and creams are frequently found in the MedPass cart. That's not where they belong. Nurses generally have a bad habit of throwing everything on one cart and going down the hall and forgetting to put it back on the treatment cart. Topical ointments and creams should be stored separately. They should be in the treatment cart. If your facility doesn't have a treatment cart, then you may store them in a separate drawer. But I would caution you to make sure they are being stored in their original container or they're being stored in separate baggies. And the reason I say that, I don't think there's anything more disgusting than when I open a treatment cart or a drawer with ointments and creams, and you've got vaginal creams thrown in with topical stuff and everything else. I mean, it's just a huge source of infection control concerns. If you have bottles that need to use scoops for measurement, the scoops should be stored in a baggie outside the bottle. The baggie itself should be labeled with the patient's name. Any syringes for liquid medications should be discarded after use. And I will make an exception here to say that there are specific control meds and specific antipsychotic meds that come with a special syringe. If that is the case, those syringes need to be rinsed and they need to either be placed back in the box. And those medications are usually dispensed in a box, be placed back in the box or be placed in a baggie to avoid contamination. Bottles should be wiped clean in the med cart. There shouldn't be any excess spillage, crumbs or anything else in there, and all labels on all your medications should be legible. Next slide, please, Josh. When you're going on your MedPass with your nurses, or even in between, it's an excellent time for you to check your med prep areas. You'll want to check the refrigerator. Is there a thermometer? Is the refrigerator being maintained according to CDC and national guidelines? And generally that's between 36 and 46 degrees. Some facilities have digital thermometers where the temp is being set to a computer program. Other facilities are still using a paper trail for monitoring temperatures daily, and that should be done. So check to see what your facility is using. Are the medications in the refrigerator being stored by route of administration? You know, when you open your refrigerator, you'll see these little baskets and they'll have eye drops and insulins and everything else thrown in the same basket. Medication should be stored by route of administration, and nurses need to remember to return items back to their original container. The bottles or vials inside of boxes should be labeled appropriately. Any vials that are open need to be dated, and those things that you're going to find in the refrigerator are going to be your TB solution, your insulins, things like that, that always should have a date on them. You want to check to see, are the surfaces in the refrigerators free of spills? Be sure there are no food, drinks, or personal lunches in there, as we sometimes see. And the refrigerator needs to be ice-free and should be defrosted if many of them will have ice on them. So take time to do defrosting on that. As you're looking around the med room, you're going to be looking into the cabinets. You need to make sure that stock's being rotated. Things are being stored by route of administration. that you're not seeing IV medications that have been removed from the manufacturer's outer bag. The thing with that is that could possibly cause a puncture to the IV bag itself. As I said, medications need to be stored by route of administration. Always check under your sinks. Many facilities will put a lock on that cabinet under the sink. You want to make sure that there's no contamination from water, and nothing should be stored on the floor. Next slide, please, Josh. Okay, so we've given you some references for our presentation today. I just want to check, you can come off mute, see if there are any questions, put your questions in chat.
There's a question from Tiffany. How do I get on the mailing list to receive slides being presented? So Tiffany, the slides have to go through a 508 compliance, which is a federal government requirement that we make the slides accessible for those with disabilities. So once we have that squared away, they should be publicly posted on our website. If you aren't receiving emails from us, please let me know what facility you're from and your email, and put that in chat. That way I can make sure that you're on our contact list, because we send everyone on our contact list information. Sheila says that this was a great presentation. I'm going to share the replay info with several people for tomorrow. Thanks so much, Sheila. Appreciate that. And Kim Roberts posed a question, the website, please. So Kim, I will get that website and I will follow up with you after the presentation. But other than that, I don't see any other questions from the session. If you could just let us know if you thought today's session was helpful, that would be very much appreciated before you sign out of the meeting. In the meantime, please feel free to reach out to us via email if you have any questions, or if you need any support with your quality improvement initiatives. We're here to help support you.